Hey friends, welcome back to my channel Fundamental Studies, a channel that clears your basic concepts. I hope that you all are doing really well and enjoying studying with fundamental studies. So friends, today I'm back with another topic from anatomy and specifically head and neck, and that's being the facial muscles. You see, our face is such an important part to our body that almost all our gestures we can express only through our face, through our facial muscles. As you can see on your right hand side, there are a few expressions, right? So we could just express our feelings through these facial expressions, like if you're angry or you are happy, you're laughing, smiling, everything we can express through our facial expressions. And our facial expressions are guided by facial muscles that make up a very important part of our face. You see, these facial muscles are the subcutaneous muscles. Okay, talking briefly about these muscles. Embryologically, these muscles develop from the mesoderm of the second branchial arch. They develop from the mesoderm of the second branchial arch, and you know that the second branchial arch has the nerves have facial nerve as its nerve, right? So thus these muscles are supplied by the facial nerve. Morphologically, morphologically, these represent the remnants of Panniculus carnosus. The facial muscles are the remnants of Panniculus carnosus. Okay, and functionally, these muscles surround the three openings of our face. The three openings of our face are the palpebral fissure, the nostrils, and the oral fissure. Okay, now talking about the classification of these facial muscles. So, this is the broad classification of our facial muscles. I would want you that you all just take a screenshot of it so that it could be easier for all of you to remember these muscles of face. So, in total, you have six categories. Okay, these six categories are muscles of the scalp, the auricle or the ear, eyelids, nose, mouth, and neck. Okay, so now talking about muscles of scalp. So in scalp you have one major muscle and that is occipitofrontalis. So friends, I have already dealt in detail about this muscle in my video lectures of scalp and I have shared the link below. So I would want you to just have a watch on this so that you could be more clear with the occipitofrontalis muscle. Okay. Now moving on to the muscles of auricle. So as you all can see in this diagram, you can see three muscles or three types of muscles. One is the one type is running anterior to the ear auricle, other is running superiorly, and third one is running posteriorly, isn't it? So in total, you have three types of muscles of auricle, that is Auricularis anterior, Auricularis superior, and Auricularis posterior. As you can see, this is the ear auricle or pinna. So, the muscle fibers that run anterior to the ear auricle make up your Auricularis anterior. Okay. The muscle fibers that run superior to your ear auricle make up Auricularis superior, and the muscle fibers that run posterior to your ear auricle make up Auricularis posterior, right? I hope that this is clear to you, and I'll show you an image that could make your concept more clear. Yeah, so friends, just have a look at this image. I hope that this image is quite clear to you, and this would provide a good insight to you of what I have explained you just right now. You see, we have three types of muscles of the ear, or you can say that there are three types of muscle fibers that surround your ear auricle. So this is your ear auricle or pinna. The fibers that uh, the fibers that are directed towards your scalp are the Auricularis superioris. You can remember it as S for scalp and S for superioris. Okay. The muscle fibers that are directed anteriorly, as you can see over here, these represent your Auricularis anterior fibers. Okay. And thirdly, the muscle fibers that are projected posteriorly towards your occipital part. Okay. You see, this is the occipital and you have Auricularis posterior. Okay. Now see, talking briefly about the cranium. This is the frontal bone. This is the parietal. This one is the parietal. This whole is parietal. This is the temporal bone. This is the occipital bone. Okay. Now let's just summarize. This is the ear auricle. Okay. You have three types of muscle fibers surrounding your ear. The fibers that are directed superiorly, as you can see, the fibers that are directed superiorly towards your scalp are superioris, like S for scalp, S for superioris. Quite easy, I guess. The fibers that are directed anteriorly, okay, these are auricularis anterior. Okay, the fibers directed anteriorly are auricularis anterior, while the fibers that are directed posteriorly, as shown in the diagram, these are your auricularis posterior. So these are the three muscles that surround your ear auricle. Okay, and one very important thing to be noted here is that these muscles are vestigial. These muscles are vestigial muscles, like I mean they do not play much role, and so this point is to be remembered that these muscles are vestigial muscles. Okay, now moving forward. Yeah, so coming back to our basic classification, you see, now we proceed on to category number 3, that is muscles of eyelids. Okay, so you have three muscles in total. The one that you can see over here is this is the eye, and the one marked with gray, like I mean just surrounding your eye, like these are these one. See, the one marked with arrow, these grey one that just surround your eyes are the ones which are termed as orbicularis oculi, okay? And the one that are marked with blue are your corrugator supercilli, right? Besides this, you even have a third type of muscle, and that is the LPS or levator palpebrae superioris. Okay, now showing you these more clearly. Yeah, just have a look at this diagram and you could be more clear. See, this is your eyelid, and the muscle just surrounding your eyelid are the orbicularis oculi. Okay, now oculi means opening, ocular, that is eye. So the ones surrounding your eyeballs are the orbicularis oculi. Talking briefly about these muscles, you see orbicularis oculi muscles have three parts in total. The one is the orbital part, that is on and around the orbital margin. Like you know that we have bony skull, right? And these are the orbits. Just a second. Yeah. So see, imagine we have orbits, and you know in orbits we have skull. Okay, so now the group of fibers, the one I'm marking with white, the group of fibers that surround your orbital margin, or the ones that are present on your orbital margin, are is the orbital part of your orbicularis oculi. Okay, now talking about the second part. The second part is the palpebral part, this one, the group of fibers or the muscle fibers that are present in the lids, like these one. Okay, This is the palpebral part. And the third one is the lacrimal part, that is lateral and deep to the lacrimal sac. Okay. So orbicularis oculi. Let's talk about its functions. Okay. Yeah. So, as I told you that you have three parts for orbicularis oculi, the orbital part, palpebral part, and the lacrimal part. Okay. So, talking about the first part, that is the orbital part, the part that surrounds or is present around the orbital margin. So, this part protects the eyes from bright light, wind, and rain. Like, I mean to say that they cause the forceful closure of eyes. These are the function of the orbital part is that it will close the eyes forcefully. In case you might have noticed that when your eyes are open, you're doing some work, and suddenly or let's take an example. Like, see, at night when you are traveling or you're walking and suddenly a car comes your way, or a car confronts you. So in that case, your eyes suddenly close, right? So that is just because of the orbital part. Okay. Second one is the palpebral part. Okay, now you know that we blink our eyes, right? So this blinking is played by the palpebral part. Like, the blinking of eyes is because of the palpebral part of the orbicularis oculi. Talking about the lacrimal part, the main function of the lacrimal part is that the lacrimal part supports your lower eyelid. This is your lower eyelid, so the lacrimal part will support your lower eyelid. Okay. Now moving forwards to next group of muscles. So here you go. You have four types of muscles that surround your nose. The first one is the procerus. Okay. Now see, let me just make over here. See, uh, this is your face, and suppose you have nose over here. Okay. So group of muscle fibers which just surround your nose, like these one, the one marked white, this is your procerus. Okay, this is the procerus muscle. Besides this, you have compressor naris. Compressor naris, as the name indicates, compressor, muscles that will compress your nasal aperture. Okay. Now just uh, antagonistic to it, you have another type of muscle fibers, and that is naris. As compressor naris was compressing the nostrils, dilator naris will dilate your nostrils. When your nostrils will dilate, so you would have more amount of air flowing into your respiratory tract. Okay. And then last one, you have depressor septi. Depressor septi will pull your nose inferiorly. Okay. Now, I want to mention and specifically talk about the two muscles, corrugator supercilli and procerus. Okay, so as I was saying you that let's just talk specifically about corrugator supercilli and procerus. You see, the corrugator supercilli is responsible for producing vertical lines on your forehead, as in case of frowning. On the contrary, the procerus muscle, which is located over here, it is responsible for the transverse wrinkles. Okay, that just take the screenshot of this image, as this image will clear your concept regarding corrugator supercilli and procerus, which most students have confusion with. It's very simple. See, corrugator supercilli, the main function of corrugator supercilli is that to create vertical lines, as in case of frowning. As you can see in this image, you have these vertical lines. See, you have these vertical lines. Okay. So this is just because of corrugator supercilli. On the contrary, you have Procerus, and as you can see this part of the patient's face, that Procerus will cause transverse wrinkles. Okay, over your face it will cause transverse wrinkles. Now, moving further. Now, friends, talking about muscles around mouth. You have 11 muscles around mouth. Okay, so I know when you would be seeing your anatomy books, it would be so difficult for you all to just memorize about these muscles. But just a second, one point I just missed on to. Yeah. So you have a mnemonic, to remember the muscles of nose. It's called PCOD. Otherwise, you know that PCOD is polycystic ovarian disease. But just exclude the word O. For from P you have Procerus. From C you have Compressor Naris. From D you have Dilator Naris and Depressor Septi. So PCOD is the mnemonic to learn the muscles of the nose, right? So moving forward onto the muscles of mouth. Okay, so this is about the muscles of mouth. There are total 11 muscles in total. Okay, and it would seem so difficult that how do we remember. So again I have a mnemonic for you. It states BMW Dilado Har Rose. Just it is just a fantasy. I know that it's practically not possible for all of us to have a BMW every day. So just creating a fantasy, BMW Dilado Har Rose. In this, just omit the word her. From BMW, just take the words B and M. Dilado say D and L are the only two words that we need to pick up, nothing else. From Rose, we have all the four initials. From B, you have Buccinator. Okay. From M, you have Mentalis. DL, you have 2D and 3L. 2D are Depressor anguli oris and Depressor levi inferioris. Okay. From L, you have Levator levi superioris, Levator anguli oris, and Levator levi superioris aliquinesi. Okay. Now, it's very simple to learn about these muscles just simply by looking at their names. Okay. See, depressor anguli oris means it is a muscle that depresses the angle of mouth. Okay. Anguli oris means corner of mouth or angle of mouth. So a muscle that depresses the angle of mouth is depressor anguli oris. So just imagine, you know what, that in this entire world you have everything in balanced proportions. Like, see, if we all are having hands, so it's not like this that each one of us have only one hand and one leg. No, we have two hands, we have two legs, we have two ears. So you see, everything is balanced in the universe, in the nature. So does our muscles of facial expression. If you have a muscle that depresses your angle of mouth, so definitely you would have a muscle that would elevate your angle of mouth, isn't it? So that is the levator anguli oris. Levator means that it elevates anguli oris, the angle of your mouth. Okay. Now, talking about levator levi superioris, a muscle that again elevates, but levi is for lip, right? So as labii is for lip, so levator labii superioris will elevate your lip. Okay, which lip? Specifically, it will elevate your upper lip. Okay, it will elevate your upper lip. Okay, now as I said that the universe is in balance, it is in equilibrium. Okay, so if levator labii superioris is elevating your upper lip, so what will the depressor labii inferioris do? It will depress your lip. Now see, levator labii superioris was elevating the lip. Depressor labii inferioris will uh, you know uh, depress the lip. But now see, the lip that is being elevated and the lip that is being depressed are different. As I mentioned that in levator labii superioris you have upper lip that is being elevated, but in depressor labii inferioris you have the lower lip that is being depressed. You can just remember this as also that you know that these are the lips, okay? So you know upper lip is present towards the upper part, and lower lip is present towards lower. Upper means towards up, lower means low. Depressor labii inferioris means down. So down you have which lip? It is the lower lip. And superioris, superiorly you have which lip? It is the upper lip, right? So levator labii superioris, depressor labii inferioris are concerned with lip. Since labii they are concerned with lip, okay? Levator means elevation, depressor means depression, okay? Superioris means upper lip, inferioris means lower lip, okay? So levator labii superioris will elevate your upper lip, while depressor labii inferioris will depress your lower lip, okay? Now moving forward, now talking about the next muscle, and that is levator labii superioris aliqui nasi. You see that this muscle, the function of this muscle is that, see, levator labii superioris aliqui nasi. Levator means, let's just break it. Levator means to elevate. Labii means something to do with lip, isn't it? Superioris means maybe upper lip, yes. Aliqui nasi means nose, okay? So this muscle will have two functions. Levator labii superioris means just like levator labii superioris, it will elevate the upper lip. Aliqui nasi, something to do with nose, so it will dilate the nostril. It will dilate the nostril, okay? So levator labii superioris aliqui nasi will elevate the upper lip and dilate the nostril. You see, these muscles of facial expression are very, very simple. Just the thing that you need to do is just break the entire name of the muscle into small parts, and you are already clear with the concept. Okay? Now, moving forwards. Rose. You have all the four initials. From R, you have Rhizorius. From O, you have Orbicularis oris. Remember, we did Orbicularis oculi, and now we are doing Orbicularis oris. Orbicularis oculi was the muscle of eye. Orbicularis oris is the muscle that is present around your mouth. Then you have 2Z, zygomaticus major. So, zygomaticus major and zygomaticus minor. Okay. Now moving forward to its diagram. Now just have a close look at this diagram. See. Okay. So this is frontalis muscle. Basically, it is just a second. Yeah. So this is the frontalis. It is the part of occipitofrontalis muscle of the scalp. Okay. Now talking about Procerus. Now talking about Procerus. You see, this is Procerus muscle. Okay. Now next, as you can see that the muscle just around your eyes is Orbicularis oculi, and the muscle above here is Corrugator supercilli muscle. Procerus was responsible for transverse wrinkles, while Corrugator supercilli was responsible for vertical lines in forehead, as in case of frowning. Okay. Moving forwards to next type of muscle. I told you levator labii superioris, levator labii inferioris, levator labii superioris, and levator or depressor labii inferioris. Okay. See, here is levator labii superioris. Insertion is over the upper lip. Okay. Insertion is over the upper lip, so it will elevate the upper lip. Depressor labii inferioris. This is depressor labii inferioris. Insertion is towards the lower lip, will depress the lower lip. Okay. Next, you have levator anguli oris, depressor anguli oris. Okay, so here you go. This small part is levator anguli oris, and this small part is depressor. Yeah, this is levator anguli oris, and this one is depressor anguli oris. As the name indicates, levator anguli oris will elevate the angle of mouth. You see, this is the mouth and this is the angle. So angle of mouth is being elevated by levator anguli oris. Like in case of smiling, it is levator anguli oris that plays the role. Okay? Why? Since it is elevating your angle of mouth. Okay? Depressor anguli oris is this. It will depress your angle of mouth. Okay? Now, moving forwards. Okay, so in muscles around the mouth, we even read about zygomaticus major and zygomaticus minor. Okay, zygomaticus major and minor. We also read about the buccinator rhizorius. Okay, first of all, talking about zygomaticus major. Okay, so first of all, as you can see in this figure, this is your zygomaticus major muscle. This muscle originates from the zygoma or the cheekbone. Okay, here you have your zygoma or cheekbone. So this is the anterior aspect and this is the posterior aspect. So as you can see that if this is your cheekbone, so you can see that muscle is arising from the posterior aspect of the zygoma or the zygomatic bone, and it is being inserted at over here. This is the angle of mouth. See, this is the zygomatic bone. Okay, this is arising from this posterior aspect and getting inserted over to the angle of mouth. Okay, so again, the contraction, when the muscle will contract, so it will contract upwards in this direction. Okay, so thus it will, since it is being inserted over the angle of mouth, so it's very evident from the figure itself that it will pull the angle of mouth upwards, just upward as well as laterally. Just see the direction of arrow. It is the arrow over here is pointing upwards and laterally, so thus it will elevate your corner of mouth upwards and laterally, just as in case of smiling. Okay, now talking about zygomaticus minor. Okay, so this is just next to this zygomaticus major, you have the zygomaticus minor muscle. Now, as I told you that this is the zygomatic bone. Okay, from its posterior aspect you have the zygomaticus major muscle. Okay, so what about zygomaticus minor? It arises from the anterior aspect of the lateral surface of the zygomatic bone. See, this is the lateral surface of the zygomatic bone, and this is its, and if this was the posterior, so definitely this would be the anterior. So it will arise from the anterior aspect of the lateral surface of the zygomatic bone, and it would also zygomaticus major was being inserted at the corner of mouth, right? But zygomaticus minor, as you can see that this is your upper lip, right? So it is being inserted over the upper lip. See, this is your orbicularis oris muscle, and it is the muscle zygomaticus minor is being inserted over here. That is, it is being inserted over the upper lip. Okay, so since it is in inserting over the upper lip, so here will be the direction, that is, it will elevate the upper lip. So till now we have read about 4 muscles that elevate your upper lip. One, we just read zygomaticus minor, the zygomaticus major. Then we read about levator anguli oris and levator labii superioris. Okay, now talking about rhizorius. Okay, so let's just talk about rhizorius. You see, this small tiny muscle is rhizorius. Okay, now just I want to tell you about masseter. Okay, you see over here lies your masseter muscle. Okay, masseter muscle will receive insertion over the angle of mouth. Okay, this is the masseter muscle. It has different fibers. Uh, you can go through the video lecture on muscles of mastication that I have uploaded. I have provided the link in the description below. Okay, now this rhizoiris muscle, as you can see, will arise from this masseter muscle. Okay, see, you can see here is your masseter muscle. See, this is your masseter muscle, and you can very clearly see that, see, this is your masseter muscle. Okay, and you can very clearly see that this rhizoiris is being originated from masseter muscle. Just have a look at this point marked arrow, this point. Okay, it is being inserted, it receives its origin from masseter muscle, and as you can see that it is being inserted over the angle of mouth. Yes, so what will it exactly do? It will retract the angle of mouth. It will retract the angle of mouth, that is, it will help in opening of the angle of mouth. Since it retracts, it is retracting the angle of mouth, so you can remember it as R for retract, R for rhizoiris. Okay, now let's talk about orbicularis oris muscle. Okay, so as you can see that these are your upper and lower lip. Okay, and this is band of muscle fibers that surround your lip is what is, you term it as orbicularis oris. Okay, so the main function of orbicularis oris is that it will close your lips and it will protrude the lips. Okay, it has two parts, the intrinsic part and the extrinsic part. Okay, now let's talk about a very important muscle, and that is the buccinator. Okay, so now let's talk about the buccinator muscle. See, the buccinator muscle is termed as cheek muscle or the muscle of cheek. The cheek muscle is the buccinator muscle. Okay, first point. Second, this buccinator muscle has three types of fibers. Okay, upper fibers, middle fibers, and lower fibers. Buccinator muscle has three types of fibers: upper, middle, and lower. Okay, upper fibers are the ones that originate from maxilla opposite the molar teeth. Now, as you can very clearly see, this is your buccinator muscle. Okay, and posteriorly you have molars. So upper and you can see that the first two bands of fibers are the upper fibers that receive their origin from the maxilla. As you can very clearly see that this is your maxillary bone, and these muscles are receiving this group of fiber receive its origin from the maxilla just opposite to the molar teeth. Okay, now talking about will middle fibers are somewhat over here. Okay, so they will receive their origin from the pterygomandibular raphe. See, upper fibers, as they were originating from the maxilla, so they will move straight to the upper lip. Okay, middle fibers receiving origin from the pterygomandibular raphe, so these fibers will decussate. Okay, and talking about the lower fibers, as you can very clearly see over here that they are receiving their origin from mandible. Okay, so they will be directed or they will be inserted towards the lower lip. Okay, let's just recall quickly. See, Buccinator has three types of fibers: upper, middle, and lower. Upper is maxilla, lower is mandible. Okay. Upper fibers have their origin from maxilla, okay, and they would be inserted over the upper lip. Middle fibers, they origin from pterygomandibular raphe, okay, and these fibers decussate. While the lower group of fibers, they have their origin from mandible and they insert onto the lower lip, okay. So now let's just talk about the functions of the buccinator muscle. Okay, so this buccinator muscle will basically since it is a cheek muscle, so it will flatten the cheek against the gums, and thus it will prevent the accumulation of food in the vestibule. Okay, see, since buccinator is termed as cheek muscle, so the purpose of the buccinator is that it will flatten the cheek against the gums and teeth and thus will prevent food accumulation in the vestibule. Now, a very important clinical point that is to be noted here is that in case, as I was telling, that important point that is to be noted here is that in patients of Bell's palsy, patients of Bell's palsy, as there is a facial nerve paralysis, okay, you have facial nerve paralysis. In that case, these patients are not able to, you know, lift their since they have okay. See, all these muscles of face are innervated by the facial nerve. Okay. Now, since in Bell's palsy you have facial nerve paralysis, so definitely the muscles won't be getting supply by the facial nerve, right? And that is why, in case of Bell's palsy patient, we see that the corner of the lip, the corner of the mouth droops down, and there is drooling of saliva. Okay. Also, since buccinator is not getting its nerve supply, so it will not be able to contract. Since it is not being able to contract, so thus the function of it of preventing the food accumulation in the vestibule would not be there. So thus it would start to accumulate food, and it's very common to see in patients of Bell's palsy that there is food accumulation just because of the fact that facial nerve is paralyzed, and since this nerve supplies the buccinator muscle and the muscles of the facial expression, so thus you could see that the function of the buccinator is being contraindicated over here, like buccinator is not able to perform its function. Also, in Bell's palsy, since facial nerve is being injured, so there will be expressionless or mask like face, you call it as mask like face in Bell's palsy. Mask like, why? Mask is just simply a mask, like you do not come to know anything. Patient will be completely expressionless. Why expressionless? Because muscles are not able to contract. And why muscles are not able to contract? Since there is damage to facial nerve. So let's just recapitulate. It's that in Bell's palsy, uh, since the facial nerve is injured or paralyzed, there is no supply to the muscles of face, and thus there is mask like or expressionless face. Okay, I hope that this is clear. Now, talking about mentalis muscle. Okay, you can very clearly see over here, this is the mentalis muscle. Okay, so this mentalis muscle, as you can see, that it receives its origin from the mandible. Like this is entire mandible, and it receives its origin from mandible just inferior to your incisor teeth. These are your incisors, and below incisors you have the origin of mentalis muscle. Okay, and they are being inserted over the chin. See, from here they originate. Okay, and from and over here they insert. So what is their function? to elevate and to protrude the lower lip. Simple. Now, talking about platysma muscle, which is the only muscle of the neck. Yeah. So, see, this is your platysma. This entire muscle fiber that you can see is platysma. Platysma muscle is the muscle of the neck. Okay. Now, talking about its origin. So, it has two origin. The upper part of pectoral and deltoid fascia, okay, and the fibers run upwards and medially. This is the direction of the fibers. The anterior fibers are now, since the fibers are running upwards and medially, so there would be some fibers that would be inserted onto the base of mandible. See, here you have your mandible. Some fibers are inserted onto the base of the mandible. Okay, some fibers would be inserted over this, as you can see, some are being inserted on the lower border of the mandible, some are being inserted over the lower face and lower lip. Okay, and some fibers may be continued with the risorius muscle, which we have just studied. That see, this is the mandible. Okay, here is your masseter muscle. Just a second. Yeah. Okay, see, this is your mandible. Okay, this is your mandible. Here is your masseter muscle. Okay, somewhat here is your risorius muscle. Okay, now talking about platysma. This entire is your platysma muscle. You can very clearly see that there are some fibers that are being inserted onto the base of the mandible, or the inferior border of the mandible, I would say more precisely. There are some fibers that are being inserted or are moving towards the lower part of the face under the chin. And there are some fibers that are continuous with risorius. See, these are the fibers that are continuous with risorius. Okay. So what is the function of this platysma muscle? Now, since it is being inserted onto the lower border of the mandible, so what will it do? It will depress the mandible. It will bring the mandible, it will depress the mandible. That is, it will help in opening the mouth. It will depress the mandible. It will bring the mandible down, will help in opening of the mandible. Okay, and will pull the angle of mouth downwards. In horror or fright, it is just the same. The reason is because it is being inserted onto the lower border of the mandible, so thus it would depress the mandible or would bring the mandible downward, and thus would open the mandible. Okay, now, okay, yeah, so as I was telling you about occipitofrontalis, so see, uh, this is the occipitofrontalis muscle. Here you have Procerus. Okay, and nasalis muscle again found around the nose. Now, one last topic we are left with today's lecture. Okay, so let's just talk about modulus, a very, very, very important topic. What is modulus exactly? See, modulus is nothing but simply it is a fibromuscular structure. Okay, modulus is a fibromuscular structure. Okay, if this is your angle of mouth, if this is your angle of mouth, okay, so it is situated at a distance of 1.25 centimeter from your angle of mouth. Okay, that is, it is opposite the maxillary second premolar tooth. Very, very, very important point to be known, that it opens opposite to the maxillary second premolar tooth. Not opens, it is located opposite to the maxillary second premolar tooth. Okay. Now, let's just talk about what modulus is composed of. You have five structures or five muscles that make up modulus, as you can see in the diagram. See, this is your modulus, okay, and you can very clearly appreciate five muscles that make up this modulus. First is levator anguli oris. This muscle is levator anguli oris. Second, you have zygomaticus major, okay. Third, you have the buccinator, just right now we have done. Next, fourth one, you have rhizorius, just did right now. And lastly, you have depressor anguli oris, this. So these are the five muscles that make up your modulus. It is simply a fibromuscular structure which is present at the corner of the mouth. Not exactly at the corner of mouth, it is situated one point at a distance of 1.25 centimeter from the corner of mouth, that is opposite the maxillary second premolar tooth. It is composed of five muscles: levator anguli oris, zygomaticus major, buccinator, rhizorius, and lastly you have depressor anguli oris. Okay, so friends, this was in short about your uh, facial muscles. I hope that you have got the concept really well. So this was all for today. I hope that you enjoyed the video, and if you have not subscribed to my channel till yet, so do subscribe to my channel as well, and do not forget to press on the bell icon so that you do not miss out to the latest updates and notifications of my channel. Thank you.